I am going to do your full head to toe assessment today. I'm going to start by assessing your scalp for symmetry, any abrasions. My hair looks nice and intact and symmetrical, no scars. And then I'm going to feel for your temporal pulses. Great, those are nice and present. Now I'm going to check your cranial nerves. Could you raise your eyebrows for me? Close them real tight. Open. Can you give me a big smile? A frown? Can you puff out your cheeks? Good. Okay. Now I am going to have you follow my finger with your eyes.
Mm-hmm.
Okay, great. That was the test for ELMs and all of that. I'm going to, and another cranial nerve, I'm going to have you shrug for me. Push down. Okay, great. I'm going to test some more cranial nerves. I'll have you close your eyes, and when you feel me touch your face with the cotton wisp, just say yes.
Yes. Yes. Yes. Yes. Yes. Yes.
Okay, now I'm going to do it for your whole body, so just tell me yes when you feel it.
Mm-hmm. Yes. 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 Yes.
Okay, great. You can open your eyes. Now I am going to check your masseter muscles. Just going to feel, can you clench for me?
Mm-hmm.
Great. Can you open, close, open, close? No clicking, any pain there?
Mm-mm.
Okay, great. Now I'm going to dim the lights, which I can't do here. And I'm going to check your pupils for constriction
Mm-hmm.
and
Just time it out.
accommodation, or consensuality, sorry.
Mm-hmm.
So I'm going to have you stare right over my shoulder, and I'm going to do the bright light. Okay, perfect. Pupil reacts, and the other one reacts as well. All right, look over my shoulder. I'm just going to do bright light. Okay, it reacts, and the other reacts as well. So I'm seeing pupillary constriction and consensuality. Okay, now I'm going to check the inner structures of your eyes with the light. So it's going to be really bright. I'm just going to stabilize your eyebrow here. I'm going to check for the red light reflex. You see the macula, fovea, cup, and disc in those vessels. Okay, macula, fovea, cup, disc, and that red light reflex, those vessels. I'm going to look at the structures of your eye, so I'm going to pull down your lid here. All right, it looks nice and pink. Look up for me, down, left, right. All right, sclera look great. Your eyelashes are nice and intact. No issues there. So now I'm going to assess your ears.
Mm-hmm.
So first I'm going to look at the outer structures, and then I'm going to do a whisper test. So looks like they're nice and intact and symmetrical, no lumps or deviations or scarring. So I'm going to whisper in your ear, and you just repeat back to me what I say. Red,
Red,
white,
white,
blue.
blue.
Great. Dog,
Dog,
cat,
cat,
cow.
cow.
Great. Okay. Now I'm going to look at the inner structures of your ears. So I'm going to pull back the pinna, go out, or pull up, out, and back. All right, I'm just looking with the scope. I see a nice pearly tympanic membrane, no fluid, and I see a little bit of syringe. All right, up,
Timing
out,
out.
back. It should keep going.
Okay.
Gonna take a look in here. See nice pearly tympanic membrane, a little cerumen, and everything
It'll
looks
keep recording.
good. Yeah, the green is on.
Okay.
Okay. Yeah, we're still going. All right. So now I'm going to take a look at your nose. So I'm gonna make sure everything looks nice and symmetrical. Any tenderness here?
Nope.
Okay, great. Your nose looks nice and midline. Your septum looks midline. Now I'm going to do a sniff test. So I'm gonna have you sniff in. Great. Sniff. Awesome. Nares are nice and patent. I'm gonna look at the inner structures a little with the light. See those turbinates, and that septum is nice and intact. Again, turbinates and septum is nice and intact, no polyps. Okay, great. Now I'm going to check your mouth. So I'm going to shine a light and look at your buccal mucosa in the back of your mouth, and your tongue looks good. And up underneath your tongue, your mucosa looks nice and pink. Your teeth are intact. No lesions or lumps or bumps. All right, and now I'm going to assess your gag reflex. Gonna gag you. Okay, great. Your uvula rises nice and symmetrically. All right. So now enough with that. We're gonna do, I'm gonna assess your throat and your neck. So everything looks good. Your trachea is midline. I don't see any goiter present, and no tenderness or scarring. So now I'm going to have you take a sip of water, and I'm going to be assessing your thyroid. Just hold it in your mouth for me. So I'm going to palpate for the isthmus and go right to the side of it. Tuck your head in and tilt it to the right. But I'm going to push towards the left. Swallow. Great. No goiter present there. Not feeling anything abnormal. Again, I'm going to feel for the isthmus. Go directly to the side of that. Yep, tuck your chin, turn it the other way. I'm going to push. All right, swallow. Great. Everything feels good. Now I'm going to palpate your lymph nodes. So I'm going to massage under here for your submental, submandibular, pre-auricle, post-auricle, postmental, supraclavicular, and those cervical chains. All right. Everything feels good, non-tender, any pain there? Okay. Now I'm going to be looking at your lungs. So first I'm going to look just kind of at your chest in general. Can you take your shirt off for me? Okay. So everything looks good, nice and symmetric, no scarring or malformations. So first I'm going to percuss your lungs, and then I'll listen. Okay, now I'm gonna do the back. Do you mind turning a little bit for me? Could you turn a little? Yeah, there you go. Sorry. Okay. Great. All right, and then I'll have you face forward for me, and I'm gonna take a listen to your lung sounds. All right. So whenever I move the stethoscope, I'm going to have you take a nice deep breath in and out from your mouth. Okay, great. Now I'm going to listen on the back. Again, just breathe in and out. Okay, great. They sound nice and clear. And not diminished. Also, forgot to say earlier, you have a good 2 to 1 AP diameter with your chest. So now I'm going to do your heart. So I'm going to palpate your carotid pulse first. Great, +2 and +2. Now I'm going to listen with the bell of my stethoscope for your carotid pulse. Make sure there's no abnormalities there. I'm going to have you take a deep breath and hold it. Hold it. Great. Perfect. You can breathe. And now I'm just going to have you kind of lean over like this for me. I'm checking for any pulsations or heaves, and I do not see any. Okay, great. You can sit up. And now I'm going to listen to your heart sounds. So I'm going to listen with the bell and the diaphragm, so it might take a while, but you can just breathe normally. So I'm going to listen to the aortic, pulmonic, herbs point, tricuspid, and the mitral region. Okay, sounds good. I hear S1 and S2, no accessory sounds, no rubs or murmurs. Okay. Now I'm going to do the same thing, but you're going to lay down for me.
On my back.
Get comfy because I'm going to do your abdominal exam as well. Okay. Gonna listen again, same spots. Aortic, pulmonic, herbs, tricuspid, and mitral. Alright. Sounds great. Okay, awesome. Now I'm going to move on to the abdominal assessment. I'm just looking at the contour of your abdomen and symmetry. No hernias or anything abnormal here. The coloration looks good. Contours look good. So first I'm going to listen to all 4 quadrants of your abdomen. You can breathe normally. Hear nice active bowel sounds. Okay, great. Now I am going to percuss your abdomen in all 4 quadrants. I'm going to hear. Okay, perfect. And then I'm going to be percussing for your liver border until I hear the change in dullness. Okay. I'm going to have you breathe all your air out for me. Okay. Great. Feel that liver border. Any tenderness there?
Nope.
Okay. Awesome. All right. Now I'm going to palpate all 4 quadrants. Everything feels good. No abnormalities. Any pain?
Nope.
Okay. Awesome. Now I'm going to do your peripheral vascular assessment. So first I'm just going to look at the coloration and feel for the temperature of both arms. Feel good. Any numbness or tingling?
No.
Okay, and your capillary refill looks great. I'm going to feel for your brachial pulses. Nice and +2. Now your radial pulses. +2 as well. Okay. I'm going to feel for the color. I'm going to look at the color and feel for the temperature of your legs and feet. Sorry, I'm going to take off your socks. And look at your capillary refill. It's less than 3 seconds. Any numbness or tingling?
No, my femoral pulse though.
Okay, yeah.
I'm worried about that.
I'm gonna feel for your femoral pulse. Sorry. Wait, where's your hips? Okay. Alright, nice and +2. Nice and +2. Okay, now I'm gonna have you bend your knee here, and I'm going to feel for your popliteal pulse. Great. Great. Now I'm going to feel for your dorsalis pedis pulses. Great, +2. And now for your posterior tibial pulses. And those are +2 as well. Okay, I'm going to have you sit back up again. You can put your shirt on if you want.
Yay.
And I'm going to have you stand up and stand in front of me. You can kind of this way. Great. And then, oh, I forgot the DTRs.
We could do it after that.
Okay, yeah. Bend over like you're diving in a pool. Okay, I'm just looking at your spine here. Any pain with this?
Mm-mm.
Okay, it looks nice and symmetric down the middle. All right, you can stand up. Okay, can you face me? I need you to twist to the right, twist to the left. Good. Bend to the right, bend to the left. Any pain there?
Mm-mm.
Okay, looks nice and symmetric. I'm gonna have you sit, and then I'm going to do your tendon reflexes here, okay? So first one I'm gonna do is your tricep. So I'm gonna hold your arm up, just relax it for me. and I am going to feel for that V in the tricep, and then I'm going to hit it with the sharp end of the mallet, and I'm just going to see a little reaction in your fingers. Great. Now I'm going to do the same thing in the other arm, feel for that V, and then I'm going to hit it. I see that nice little reaction. Okay, now I'm going to do your bicep tendon. So I will kind of cradle this here, and I feel for that bicep tendon, and then I put my finger over, and I'm going to tap. Good. Great. Same thing on this one. Just relax that. Good. Alright, now I'm going to do the brachioradial. So I'm going to find your distal radius and go 2 fingers above. Just relax for me. 2 fingers above, and then 1 finger above that is where I'm going to hit. Great. Now for this one, I'm going to find the distal under the radius and 2 fingers above, and then a third. I'm going to hit here. Good. I'm going to have you scooch back and have your feet hanging over the edge. I'm going to have you put your hands together like this, and when I count to 3, I want you to pull as tight as you can, okay? 1, 2, 3. 1, 2, 3. Okay. 1, 2, 3. 1, 2, 3. Okay, good. And that was your patellar tendon. Okay, now I'm going to do your Achilles reflex. So I'm just slightly supporting this foot, and I'm going to be hitting the Achilles. And I see a little flexion in the foot. All right. Good. Now I'm just going to do the Babinski, so I'll see a nice burst of response. Good. With the sharp end of my mallet. All right, and that is the head to toe assessment.